Well, today is the last installment of our series with Dr.
I'm gonna miss you. I'm gonna miss you, Boo. Randy the rectum. You guys are gonna have to send him postcards. He's gonna be so lonely.
I know, and Patty Pelvis and Philip Pelvis.
Philip the pelvis or Peter the pelvis. He's two
Or
personalities.
Peter. Okay, yeah. So, if you're just finding us, please be sure to go back and listen to the other episodes in this series for Heart Month, because it gives you a lot of the background of what we're about to do, which Kelly's been talking about relaxing our pelvic floor, and she's already given us a couple of really great tutorials. But now we're actually just going to do a legit 10-minute exercise.
Yep,
That's
10-minute pelvic floor relaxer. This is perfect. So yes, I second what Boots said. Get your cute butts back and watch the other episodes in their entirety. But this is for you when you're like, yes, I saw myself in those episodes. I want to connect and relax to my pelvic floor. This is for you. So Boots and I, if you can see us, we have just like standard hand towels that are, would you call this a hand towel? I never know nomenclature. Okay, perfect.
Yeah, I call it hand towel.
Perfect. So we'll fold it in half once lengthwise and then again in a half. So it's this little rectangle. And we are going to roll it about into a circle that's, I don't know, like about as big as my fist, right? Yep. And I'll probably make a little like handout for you for like relative size of this. And we are going to put this hand towel under our perineum, under our pelvic floor muscles. So we're going to be sitting down and we're going to set it so there is some pressure on the rectum, some pressure on the vag. And if you don't have a vag, like pressure right behind the scrotum and pressure on the rectum. So this towel is meant to fit right between your sit bones, and it kind of like a bike seat, except a little skinnier, so that it only compresses those muscles. When we sit on this towel, friends, you should be aware that you're sitting on it, like hello, but it should not hurt. So if it hurts, you might need to go to a smaller towel, or if it feels like it's actually touching your sit bones, your towel roll might be too big, so you might have to unwind it a little bit. But the key is that if we are wanting to truly connect to our pelvic floor and relax the pelvic floor, we are not sitting on this towel because we think we're going to pee our pants. We're sitting on this towel because it is giving a very gentle touch sensation to where all of these amazing pelvic floor muscles are to help the brain find them. And that is so powerful. So even if this is 2 days post-op and we've just got to the chair next to our bed the first time and we're working with respiratory therapy and they leave, oh my gosh, guess what? We could put this rolled towel under here and tune into our pelvic floors, and it would help so much with all the things. So hopefully we're all sitting down now on the towel, and I want you to tune in. Hopefully you're not driving or walking. We can sit on the towel. We are going to close our eyes. We're going to have one hand on our lower chest and one hand on our lowest belly, kind of right where our belt line would be. And you're going to take a couple relaxed breaths, friends. You're going to breathe into your lower belly and back out. And your first check is if this top hand that's on your chest, this bottom hand's on your belly, when you breathe in, if we're breathing a ton into our chest, notice that. Don't be mad, but just say, oh, that's interesting. And try to will yourself to keep the top hand quiet and take all the breath into that bottom hand. That's true diaphragmatic breathing against a relaxed stomach. And that's step one. And honestly, if this is hard, this is where you stay for 3 minutes, just doing the soft belly breathing. You sitting on this towel roll is helping your brain recognize that your pelvic floor exists, and that's enough for right now. But once it starts to get easier to feel this belly moving forward, inhale, let the belly move forward, and now tune your mind into the parts that are touching this towel. And if they're truly relaxed, as you inhale and your belly gets bigger, these pelvic floor muscles should drop into this towel ever so slightly. And exhale, belly gets smaller. Inhale, belly gets bigger. If these pelvic floor muscles are resting perfectly, they are going to kind of press down into the towel with the inhale and rebound with the exhale. But if we're post-operative, if we're having pee problems, pain problems, poop problems, stress problems, the pelvic floor is resting too tight. So we are going to inhale, the lower belly is going to get bigger, the pelvic floor is going to drop into the towel. We're going to exhale, the belly's going to rebound in, but we're going to try to keep our pelvic floor setting on the towel. And you are showing your brain where these pelvic muscles are meant to rest. And we're not pushing, right? We're just allowing them to rest. And interestingly enough, some of you might be noticing like a little ache in your vag if you have one, or in your rectum. That ache is indicative that the muscles are actually elongating. It's like you're stretching your hamstring. Isn't that fascinating? And if it actually hurts, then again, we got to go to a smaller towel roll, but we inhale and we kind of like settle into that ache and we say, oh, wow, I can feel it. It's like a little rose blossoming. Exhale, maintain that. Good job. And now your challenge, can you keep this pelvic floor down on this rolled towel while you gently engage your deepest tummy muscles to support your sweet bladder, to support your sweet pelvis? And what most of you will find is that your rectum and your pelvic floor try to tighten as soon as you tighten that tummy. But you can do better, I promise. And the fact that you notice that that's hard is awesome. That's what this is all about. And you try to hold that deep, low tummy in like 2% for 1 or 2 breaths. Yeah, I know, I'm making you breathe too. I'm so evil. And then relax everything. Take a couple soft breaths again. And then try that one more time. Pelvic floor is relaxed, rectum's relaxed on the towel. Gently draw in that tummy and breathe. And now your brain is really learning that your diaphragm is for breathing, your tummy is for supporting your pelvis, and your pelvic floor is on standby for now. And if we can master those things in that little 5 minutes, like that is going to help our nervous system and help our pee poop bedroom time function so much, not to mention overall athletic function. And, you know, if you are out in the gym at cardiac rehab, heck yeah. Active abs, relaxed pelvic floor with your warm-ups and with your cool downs to help retrain this normal resting tone. And then, yeah, we don't have to think about it forever, but while we're stressed and while we're recuperating, we absolutely do. So that's your basic. I know. How do you feel? I feel so relaxed, honestly.
Well, what I'm noticing is I'm mentally tired from that.
Yeah, it's a lot of work. And
Yeah.
the key, oh, and you can come off of the towels now. And when you come off of the towel, like just appreciate the copious space that even if you couldn't sense much happening when you were on the towel, now that you're off of it, you're like, oh, wow, there is a lot of real estate there that I'm really not connected to. And the coolest thing about pelvic floor rehab is there's so many nerves involved that it doesn't matter if we did it right or wrong. The fact that we tried to do that thing and we were curious about how hard it was mentally, or that I really couldn't feel anything, when you go to bed tonight, your brain is actually going to rewire. It's going to say, Boots and Dr. Kelly asked me to do this thing, and I could not sense anything happening in my pelvic floor. That's weird. And as long as we approach it with curiosity, it will rewire, and that's called neuroplasticity. And within 3 to 4 days, friends, you will actually feel things happening, not because the nerves were gone, but just because the brain wasn't utilizing them correctly. So it is so cool, and it's practical now and forever after, because we can't remove all stress from life, regrettably. So anytime we're in stress, I want you to come back to this podcast and relax your sweet pelvic floor and think of me.
And I just so appreciate that you call our cute butts and our sweet pelvic floors and bodies and our hearts. And I I just so appreciate you and the joy you have brought into my life through recording the series. And I cannot wait to hear from you listeners on how this has touched you. I really want to know, and then I'll make sure to let Kelly know. Like, we did this because we love your pelvises.
We did, and we want to help you. And I'm sure we're going to do it again next year. So give us feedback. What did you like? What do you want more of? And we will provide. So thank you so much for this opportunity, Boots. It has been wonderful.
Yes, thank you. Thank you for the time you've spent with myself and the listeners. And hey, listeners, I want you to think of 5 pelvises that you love, that you know they deserve to thrive. And I want you to send this series to them. I want you to send my newsletters to them. If you haven't signed up for Dr. Kelly, or to do that in the show notes. And hey, I love you. I truly do. I love your pelvis. I love your beautiful heart. Be sure to keep coming back for more with Open Heart Surgery with Boots. And if you haven't, make sure you've subscribed. Hopefully you have by now, because this series should have blown your mind and your pelvis. So much more to come this year, and I can hardly wait. So I look forward to being back with you next week. Bye for now.